Inshallah.
To that.
Inshallah, that'd be great.
You guys all there? Right. Okay. Good. So now we should be, inshallah, these lot will be joining soon. Aisha, everyone.
Share it with both, that's fine.
No, that's fine. It's good. You know what they say with guys in tech, yeah? And technology. Oh, gosh. Okay. By the way, this is Dr. Camille.
Hello.
We're having introduced. Just
Hello.
there. And Camille is a plastic surgeon, and he's specially, working with me on this particular side of the training program. So yeah, let's get into it. So basically, again, thank you everyone for being here today, and apologies for the initial glitch, but I think that's now starting to, that's starting to go around. And getting right into it, Camille, you're a plastic surgeon. Why do you feel that pharmacists should be getting involved in the aesthetics industry?
Well, I think the aesthetics industry is a really good industry to be involved in at the moment. There are some estimates, I came across some research that said in 2018, the aesthetics industry was worth about £273 million in the UK alone. And they predicted this would be worth about 3 billion in 2022. So you're looking at, if their numbers are correct and their predictions are correct, a 10x growth over 5 years. Now, whether you see that growth or not remains to be seen, but I think we'll certainly see a big growth. Now, there's many aspects to the aesthetics, as you know, but if we look at just focus on anti-wrinkle injections, or we'll call them Botox for short, because that's the most common brand name known. They don't last forever. They last a few months. It varies from patient to patient. So from a patient's perspective, it's unfortunate that you have to keep paying if you want to maintain the effect. But from a business perspective, you have a recurring stream of patients, and there are other things that they may then benefit from. People get into this for different reasons. From the patient's perspective, they either want to look younger, or they just want to look refreshed, or they just want to improve themselves. People are a lot more conscious about how they look in this kind of era of social media. And people do this to maintain their jobs. There's always someone younger and hungrier after your job, and people have different reasons for getting into it. But once they start, they don't want to start looking worse again. So hopefully, if you get a good rapport and a good relationship with your patient, you've got a patient for life there. In terms of pharmacy, I mean, we've talked before about the challenges that pharmacies face, and how you have to diversify your offerings, whether you own a pharmacy or work in a pharmacy. I think given the size of the market, I think as a pharmacist, you can then bring something new to the pharmacy that you work in, whether that's your own pharmacy or whether you are an employee. You could actually suggest, because all pharmacies have a consulting room, so you have a space where you can perform this. And it doesn't have to be every day, but this could be another income stream for your business.
So the thing is, right, that, yeah, I think it's, I think Dr. Camille has hit the nail on the head, that there's a huge opportunity for pharmacists to be capitalizing on this growing industry. And it is an industry that's growing. It's an industry that is vibrant at the moment. And, obviously social media and the media has a huge role in this. And, we've recently had these change in advertising campaigns and stuff as well with regards to aesthetics. But it's definitely, as a pharmacist, with us having, the skill set that we have, and with the right training, I think it's something that, pharmacists should be getting involved in. I guess the question is that there's plastic surgeons, there's GPs, there's dermatologists, there's nurses. Isn't there a point where this is just, might become saturated, where there's every person is doing it? So how, what's your thoughts on that? Would there being, pretty much anyone can do it with the right training, as much as it's a big market? What are your thoughts on that? Is it competitive, and should non-medics be injecting and so forth? How do you feel as a doctor? Are we not treading on your toes?
Okay, well, I think there's a couple of things to say. I'll talk about the second question first. So should non-doctors be performing aesthetic procedures.
Yeah.
And I think, yes, provided that they get a proper training, I think there should be some kind of, accreditation, professional accreditation, professional responsibility, professional accountability, and indemnity as well. But as long as you have the appropriate training, because we just talked about the size of the market there. I mean, if it was worth £3 billion in 2022, and let's just say 3 areas of Botox, so, here, here, and here, that's £350. I mean, that's a lot of injections. There aren't enough doctors to just go around injecting. You're going to get arthritis of your thumbs before too long. The market's too big. No matter what people feel about professional jealousy, which is an ugly thing that unfortunately does exist, whatever people feel about that, even if they wanted to spend all day, every day doing it, they can't fulfill the need. So it's open to other people. And I don't see why pharmacists aren't going to be equally able as doctors or nurses to perform this with the right training. So
you feel with the right training that it doesn't really matter whether you're a doctor or basically whether you're a non-medic, you don't have an issue with non-medics doing the injecting and,
No, I mean, I've talked before, I think there needs to be greater collaboration among, the different healthcare professionals, in general, whether that is doctors, physiotherapists, pharmacists, whoever. I think we need to work close together. We're all on the same side here. We should all be on the side of the patient. I know there's a difference between working in the NHS and working in the private sector, and obviously there's a bit more competition in that regard. But at the end of the day, there's enough work for everybody. So we need to just make it safe for the patients, or we need to make it ethical. And I think with that in mind, there's no reason why you can't do it.
And my thinking on it's pretty clear in that I've always said that it's not who's doing what, it's how you do the action itself. So it doesn't really make a difference whether you're a doctor performing the task or whether you're a nurse or whether you're beauticians possibly. But ultimately what it comes down to is how have you been trained and have you had the right training in actually applying your skills?
Yeah, well, yeah, I absolutely agree with you there. I guess the other thing we you asked about the competitiveness of the market. And it is a competitive market, but then what market isn't competitive at the moment? If you sell mobile phones, that's competitive.
Yeah, absolutely.
Anything you do, if you're dispensing prescriptions on the high street, that's competitive, and it's only going to get more competitive in the future, I think. So everything's competitive. So you've just got to differentiate yourself. And it's surprising with any industry sector, the number of people who don't get some basics right, whether that is their basic bookkeeping, their accounting, their marketing, just simply not getting the basics right is a problem. But then you can differentiate yourself. Now, some people might burst onto the market and want to undercut everybody, and then the next person has to drop their prices and then drop prices and so on, and then it becomes a race to the bottom, and then nobody wins and a few people will go out of business with that strategy. So that's not a sustainable business plan. So I think you need to differentiate yourself on quality and service, personal approach. These are the kind of things where you will build those longer term relationships, solve the problems for your patients, and actually, obviously people who care about it, people who enjoy it, people who are there for their patients, they're the ones who will continue to succeed, and that they will always rise, because people will come back to you, and then they'll tell their friends, and then obviously your marketing strategy is another thing, but the word of mouth referral is so powerful if you do a good job for somebody.
No, absolutely. And kind of like my journey was a bit, I kind of landed in aesthetics. I wasn't actually, I didn't plan in aesthetics. In actual fact, I didn't have a clue what the word aesthetics actually meant before I'd actually started doing it. Even pronunciation, I've heard some people say aesthetics and, aesthetics. And what had basically happened was with, being a contractor, again, you've heard this story, there was those funding cuts and something had to happen. So non-medical prescribing was always my goal, that I'm going to do my non-medical prescribing. I'm then going to set up a clinic where I'm going to manage and diagnose disease and so forth. But that never happened. And, we've discussed that story about getting onto that journey of being able to diagnose and so forth. So I turned my attentions to aesthetics. So I did my due diligence. I was already aware that there's a huge market for it. There's a huge market for aesthetics, Botox, fillers, laser, chemical peels. But aesthetics, that's medical grade. I've always, I like, there's a particular clinic who I'm pretty fond of, and they're always focusing on this idea that it's medical grade, medical grade, medical grade. So I wanted to go down the route and get some training that was also going to get me ready to be able to, to build on my aesthetics program in terms of, administration and so forth. So I went to a established brand, a training company who, I thought, having done so much research, was going to fit my requirements. But what I found was that this particular, or a lot of these training companies, it seems to be one size fits all. And that is not true. I think that the needs of a pharmacist, the needs of a nurse, the needs of a doctor are different.
So did you find that you were sort of a pharmacist who perhaps hadn't given an injection before, and you were being trained next to a doctor, for example, or a nurse who obviously has spent many years already giving injections and may also have a pre-existing knowledge of anatomy, for example, that you didn't have because it wasn't relevant to your training and accreditation? Would that be a fair assessment?
I remember my first day on the course, and there were words being thrown around like facial artery, they were using words like, oh, is it in the right tissue plane? The temporal process of this bone, oh, you've got to make sure that you know where the maxillary arch is. Didn't have a clue.
Do you feel they were trying to sort of mystify it, perhaps?
I think that there's definitely, when I was discussing with you last week, I do have an issue, like with certain textbooks, and especially in this, we're in the medical field, of this notion of trying to mystify things. Things are made more difficult than what they need to be. And I know when I went on that course, I definitely, after 2 or 3 months, left with less confidence than I should have had. Because I think there was this, there is, I don't know what it is, but people just like to make things complicated. I don't know why, but they just like to mystify things and make it difficult when it doesn't need to be that difficult. And that's what I found with that training, with the training that I did. And it takes time. If you end up going on the wrong course and you waste your time, that time can never come back.
Yeah.
And it can affect you in many ways. It can affect you, mentally. It can affect you, it can affect your confidence. And at the end of it, I did leave with having low levels of confidence, because I just thought, how am I going to ever do this?
Okay, so you were in a situation where you'd done a training course from an established brand. You sounded good, nice website, etc. You felt it was not really pitched appropriately to the level and needs of a pharmacist, even a prescribing pharmacist. You obviously invested quite a lot of time and money into this. Your confidence was low as a result. And how did you get out from there? What happened next? What made the difference for you to, obviously, because now you're happily performing procedures independently, and we can talk about how well you're doing at the moment. But what made the difference? How did you get out there?
When I went to look for an aesthetics course, what I looked for was was it taught by doctors? Because I thought, no disrespect to doctors, but I thought, I want to get taught by a doctor. It has to be a doctor that's going to teach me. 2, what I looked for, and I'll get back to your question in a second, what I looked for, that will I get hands-on training? I also looked at, there's going to be examinations, and I thought, this is it. This is everything that I need to do. But that's not the case. You see, the reality is, all the way from being able to hold, not that this is a syringe, all the way from being able to hold a syringe, all the way to anatomy and mentoring, all this makes a difference. So what I did instead was I got hold of a good friend of mine who was very proficient in aesthetics, and I started spending time with her. Every time that I would do a procedure, I would send, with consent, with obviously with consent and confidentiality, sent her pictures. And that's how I started to basically bounce back and forth, was I would regularly discuss with her through the mentoring that got me through the channel. So that's what I did after spending, 6 months on completing that training course, left like really low on confidence. Like, how do you actually know where you're injecting that product if it's actually where it should be? And I'm not sure if Lisa is actually on the webinar today, but I've spent time with her going through kind of like teaching her aesthetics. Ultimately, what did make a difference is being in the right hands. As long as you're in the right hands and someone who's been through the journey, no disrespect to a plastic surgeon, but how long have you spent on this?
Longer than I care to mention.
Yeah, years.
I graduated 20 years ago.
Well, there you go. You see, so I needed someone who said, okay, Fahim, I can understand your needs. Okay, I know how to get you from A to Z without coming off for every single terminal, without you having to know every single side street. If I want to drive from here to London, I need to know the main streets. I don't have to be aware of every single junction that takes off. That's what I needed. And that's what she did. She said, okay, look, scrap what learning you've had. Let me go through it. So I started spending time with her. We did go through anatomy because you need to have an understanding of injection anatomy, because why that's important, because you see with Botox and fillers, it isn't where the needle is, it's where you're placing the product. We know the needle's in your hand, you've got the syringe in your hand, it's where are you placing the product? And so that was something we spent time on. How do I know that I'm placing the product correctly? We discussed what happens when things go wrong. Because, with Botox and fillers, more so with fillers, we've heard of, occluding arteries, occluding blood vessels and so forth. So we discussed that in depth as well, that what happens when things go wrong. We discussed managing complications. What she couldn't help me with was how do you actually, run a successful clinic? That part she couldn't help me with. Neither did the training course help me with that. Okay. How do you actually make money out of this?
Well, I mean, I just talk about running successful clinics. So at the moment, obviously you're still working as a pharmacist, so you work as a prescribing pharmacist. So, and I know you you consult patients independently and come up with treatment plans and prescribe for them. But just on the aesthetic side of the business only, do you mind me asking what your turnover is?
So my turnover with just my aesthetics, and I actually like to group my consultations in 2 days because I have as you probably know, there's a lot going on, from my anatomy to my physiology to studying and so forth. So I normally dedicate 2 days a week. I have my clinic. I book my patients in, and it's normally 19.3, and my turnover is probably touching around £15,000. Last month that we did on just my aesthetics business.
Is that so? It's £15,000. Is that a typical month, or was that a good?
No,
month?
that's now a typical month.
So £15,000 turnover per month.
Absolutely.
On 2 days a week.
Yeah.
9 till 3.
Yeah. And but that would.
And how many patients? I mean, 9 till 3. I mean, I'd guesstimate about 10 patients in that time. Is that about? Because obviously there's a bit of turnaround time. You need to give patients enough time so they're not feeling rushed, particularly.
The thing is, right? You have a patient who wants treatment for wrinkle reduction, for example. You're looking at 3 areas is close to 350 to 370 pounds.
Standard sort of
that's
price.
A standard price.
And the pricing is pretty similar.
Yeah, most places will do that. So you're looking at about 350 pounds. Now, that same patient or client may want some work done on the lips. And again, it's really important to remember that you can't change what's there, but we can enhance what's there. So, a lip filler, you're looking at anything above 250, 300 pounds just on lip fillers. I think, I charge for lip fillers for a mil about 350 pounds for 1 mil lip filler. So again, you can just scale that up. But the key to this is Botox. It's something you mentioned earlier on. Fillers last normally, 6 months up to a year. Botox is recurrent. And that's an advantage because it's a good thing and a bad thing, but it's a recurring business. And that's important. Again, they didn't teach me that in my practice. I was so focused on Botox, fillers. But the recurring business is your Botox, and is you teaching them basic dermatology. Look, you can spend thousands of pounds on the face.
Mhm.
If you're not protecting yourself from the sun,
Mhm.
what's the point?
Yeah.
And that's how you can give them value and start to upsell.
Although, again, a lot of the damage may have been done 20 years ago for some of the patients. Unfortunately, you
Yep.
can't go back in time per se, but we can sort of improve on its appearance. And actually, the other thing you mentioned about Botox, because it's such a strong brand, because obviously it's like Hoover, you know, people, even though Dyson is probably more popular than Hoover, everyone knows what a Hoover is. But that was a brand. That was a brand of vacuum cleaner. But people say Botox when really they mean a botulinum A toxin injection. And there are other brands as well, we should say, for completeness. But it's got an incredible amount of uses. But obviously, we're just focusing on the wrinkle reduction today.
I think that's a valid point. You know, Botox isn't just used for wrinkle reduction. It can be used for migraines.
Mm-hmm.
It can be used for, I think it's used in, is it used in for bladder and unit?
Oh yeah, any kind of issue in the body where you've got a muscle that spasms. So there's all kinds of things like torticollis where you get a spasm in the neck.
Not that we would be,
but no,
for that, but it has many uses.
And you can actually, there's a picture I've seen somewhere where there's a picture of the human body, and then just all the different things, starting with, you know, the squints. That's how it was first used. It was used to correct squints in the eyes, and then some of the patients noticed that their crow's feet were getting better, and the ophthalmologist, there was an ophthalmologist in America called Carruthers, who was married to a dermatologist, and she mentioned it to her husband. And then he looked into it, and it exploded from there, really. So yeah, but anywhere in the body where there's a muscle spasm, but also it can be used for hyperhidrosis or excessive sweating, as well.
Again, that's another one, excessive sweating.
And that's something that, again, it obviously with the right training,
I find that to be more simpler.
Yeah, I think it's simpler because you're following more of a pattern there. I mean, I know not a one size fits all, because you know there are ways of deciding exactly where to inject it and how much, and obviously you need to sort of titrate the dosage as well. But I think there's maybe just a bit more. Well, there is more finesse, I think, required with any facial treatment, whereas I think it's a bit more forgiving in the axilla, in the armpit.
The thing is, you know which I hope what most of you would want to know is, how do you get into aesthetics, and how do you develop your competencies to obviously set up a clinic? Now, the first thing is that getting into aesthetics requires training, and that means, you know, high quality training is important. Someone who can guide you through from start to finish, because without the training, you're never going to feel comfortable. Once you've got the training under your belt, then it comes down to your business skills. You being able to market yourself properly, you being able to, you know, that value that you have, demonstrate that to your patients. And once you've done that, it starts to trickle over. That's the two most important things with this. And it takes time, guys. There's no rush. It does take time. You know, with anything, you know, how long is a piece of string? It's like when you learn to drive, right? You can pass the test, but you need to practice, and you need to have access to someone who's there to support you. And again, with the Medlin Mastery Program, you know, those are the students who are on there. The value of having a mentor is second to none. You know, I have spoken with Camille many times, but I've rang him and said, Camille, you know, can you have a look at this picture? I'm not too sure what this is. You know, is that an occlusion? Could that turn into an occlusion? And how would you manage it? And these things make a difference. If you've got access to, you know, a course that provides you mentoring, provides you someone who's been through the journey and can relate with you, you can't go wrong.
So how long do you think, how long has your journey taken you from your sort of very first kind of discovery day or foundation day in aesthetics to sort of, you know, to where you are now with a monthly turnover of 15K on two days a week?
It's because of look, when I did my aesthetics, I had no one to speak with. There was no webinar. No one did a webinar on aesthetics. You literally went on the internet and you just searched, and you just did what you thought was right. I didn't have anyone to speak with. There was no, you know, we don't have that luxury. I didn't have anyone to speak with, and if I did speak with anyone, I did speak with, very wishy-washy. very wishy-washy. Yeah, it requires a long time. Or they would say things like, oh, it's so competitive, don't get into it. I'm thinking, well, then why are you into it then? Did it make sense to me that, wait
That's
a
always
second,
classic. That I
Oh,
love that. Don't do this.
Yeah.
I'm doing it, but no,
Yeah.
you don't want. It's not for you.
yeah,
No,
you know,
don't
so
want it.
I
Yeah.
got told don't do it, you know, and I thought to myself, well, if you're doing it and you're not working as a pharmacist,
Mhm.
and you've got this, you know, Ferrari parked outside, you know, and something's not hitting home. So don't do it was another one. No one to speak to,
Mhm.
you know, and you know, alhamdulillah, with the will of God,
Mhm.
you know, I am happy to speak to my colleagues, you know, send me a message, more than happy to discuss it. So I never had that luxury where
Yeah.
someone could tell me, okay, Fahim, in order to become good at this is what you need to know. So it took me 2017,
2017. So we're 2020 now. So three years basically.
3 years.
From not having picked up a needle to independent pharmacist
And
of the year.
it shouldn't have
Yeah.
taken that long
So
to become good at aesthetics.
based on your journey, I mean, you could basically save somebody a lot of time if you were to train them, take them under your wing, train them. Would you say they don't need to spend 3 years? I mean, you know, actually, I saw an article the other day. We're talking about a shortened course to become a doctor.
Oh,
in 3
yes.
years. So you know, it would take 3 years for you to become a doctor. You know, it shouldn't take you 3 years to get competent in aesthetics.
Again, if you have the right teachers, and when I say teachers, somebody who enjoys what they do. It's not just anybody can teach, right? All of you.
Well, I disagree. I don't think anybody can
No?
teach. I think lots of people can do something. I mean, anybody can plonk an injection. I can plonk an injection there, but you know, you've got to do it with a certain amount of finesse, precision, and judgment. But I don't think some people can do things really well, but they can't teach it.
Yeah.
I think some people, there's two different things. There's one is knowing the stuff and doing the stuff, which people can do. And then there's then being able to take that knowledge, break it down into the steps, because otherwise, well, I just do that and that, and I put 2 units here and 5 units
You know,
there.
you mentioned that. Let me
Yeah.
tell everyone of one of my biggest secrets. I have great teachers. Camille, Dr. Akib, Dr. Amna Khan, Dr. Hassan, you know, Dr. Rahimi, Dr. James, Dr. Ben. They will always break down that information to the level that I need it for. And that makes a difference. Same thing with aesthetics. You can break down, you know, for example, I remember we were taught about facial mapping, and we were taught about dividing the face into fifths, into fourths, and into different segments.
Yeah.
There's a search it up, guys. I think it's the phi theory.
The
ratio,
golden ratio.
the golden
kind of
ratio.
Da Vinci Code stuff. Yeah.
You need to, honestly, if you haven't done it, I'm going to put it on the chat. You need to search this up, the Da Vinci Code, or what's it called? It's called the.
Well, the Da Vinci Code was a book.
Golden ratio.
The golden ratio, yeah.
The golden ratio. I had spent months on this ratio, just trying to figure out how can I get this person to have the golden ratio. No one to speak with and say, Fahim, it's just.
Can I tell you how long I've spent on golden ratio?
How long?
Well, I think I read the Da Vinci Code once on a coach from Switzerland to France. That's about as much time as I've spent on the golden ratio. That's literally. I mean, yeah, it's there. Maybe if you were to bother measuring it out, but that's not really.
I never had.
It doesn't have that practical. It's interesting. It's academic, but it doesn't have that practical value.
At that time, I never had Camille to speak with, so I did go to research in golden ratio. Again, it takes time, and time is effort, and it costs.
Yeah. Well, if you did, I'd have said, well, actually, just watch the movie, don't read the book. Then that's all you need. That would have saved you a few hours. Yeah.
But yeah, definitely. I mean, you know, you can. I think with the right training, and that's the discussion that me and Camille have had when I've sat down and seen Dr. Camille. I want to develop a training program that is specially designed for pharmacists. I want this course to be for pharmacists. I don't want it to be, you know, I want that to be, as long as we can design a course that's in mind for pharmacists from start to finish, we need to get these guys who want to practice aesthetics or are considering aesthetics, getting them from A to Z a lot quicker than spending 3 to 4 years.
Okay, so with that in mind, I mean, we have designed a training program.
Yep.
Again, aimed at pharmacists. But what do you think makes our offering different to any other courses out there? Either ones that are aimed at pharmacists, because there are a few out there, or just the other ones that are aimed at everybody?
Look, anything that I put my hands on, doesn't matter what training course it is, it's going to be great, because I generally have a passion for it. And any one of you who've listened to my webinars or have been in touch, or, you know, you can speak with, you know, You can ask Farah, you can ask Nazmi, you can ask these guys who are on this webinar today, that I thoroughly enjoy what I do. Rule number one. Number two is because it's designed with the premise in mind that we are helping pharmacists. That's important, that this course is not designed, no disrespect, it's not designed for doctors, it's not designed for dermatologists, it's not designed for GPs, it's designed for pharmacists. So it doesn't matter what level you're at, we take you from beginner and work the way up. It's not one shoe fits all, because that's, one size fits all, because that's not the case. That's important. Secondly, having a plastic surgeon, it makes a huge difference. Again, they say that there's levels to this. You might have heard this sentence, that there's levels to this. You've got, again, example I'll give you, let's have a look at football. They're all professionals, but Messi and Ronaldo are a class apart. They're all professionals, but there's levels to this. And again, even with aesthetics and with surgery, there's levels to this. If you want to be taught, it should be by someone who spent a lot of their time in that field, hence plastic surgeon. What better than being taught by a plastic surgeon who does it day in, day out, versus someone who is, proficient at it, but is not a surgeon. I would always put my hands down and say plastic surgeon. And I'm not aware of any course, and do let me know if there is a course that is taught by a pharmacist and a plastic surgeon. I'm not aware of any course.
I don't. I mean, there are some obviously plastic surgeons teaching Botox. Of course, of course they have to be. But in terms of actually aiming it at the needs of pharmacy, I don't believe there's another one out there. And I mean, with that, we've tried to design a course from the ground upwards, based on your journey. Based on what you found was good and what was bad and what you found you needed, to give some shortcuts to anybody who wants to join it, so they don't take 3 years to get to where they need to be. But what should we talk about? What are we going to cover on the course?
Yeah, definitely. I mean, if you're going to look right, let me make it very clear. If you're going to be injecting anywhere in the body, I don't care if it's in the deltoid muscle, I don't care if you're injecting Botox, in the facial region, you need to know where you're putting your needle. Okay, so how you know that is, first of all, the theory. You have to know your anatomy. You have to know exactly what vessels are coming from where. Now, that's a double-edged sword. And the reason that's a double-edged sword, and you'll be able to probably explain this better, is to do with individual variation. Because the last time I checked, apparently the facial nerve can have 10 to 12 different variations. So there's one variation where it can branch into 2, one where it may just branch into 1. So, as much as you can learn the theory, is that correct? That there is
I think that there's always a degree
anatomical variation.
There's always a degree of anatomical variation, but there are some things that are fairly consistent. So whilst it's sort of, and we'll talk, we'll cover the anatomy that you need to know to be safe.
Yeah, absolutely. So what anatomy you need to know to be safe, that's number one. Secondly, product selection. Not every product is the same.
No.
You need to know the difference in, why do I use Juvederm? Why do you use Boloterra? There's a Teosal, I think, is another brand that's available. What's the difference in the actual ingredients? What's the hyaluronic acid versus collagen? What is a permanent filler versus semi-permanent fillers? So that you need to know as well. You need to know where you're injecting that product. And we talk about the word plane, we talk about the word tissue plane. Again, you'll be explained that on the day itself and all that tissue plane is literally you've got a tissue, which is a collection of cells. Where are you injecting that? Are you injecting it just below the epidermis into the upper portion, which is like, or the higher portion of the dermis? Are you going below the dermis, going into the fat? Because ultimately with aesthetic work, it is not just about injecting fillers in the face. You have to understand the aging process. You have to understand the structure beneath, how the ligaments, how they actually form the underlying structure. So that has to be explained as well. And also appropriate consent. That's important. Record keeping. And now advertising. Because
and marketing.
Yeah. I mean, advertising and marketing has become slightly more interesting now, because you're not legally allowed to advertise we do Botox, or even words like anti-wrinkle injections. If you're not aware, do your research. but it has
But
changed
we'll
now.
cover that. We'll cover
Yeah.
the regulations on that.
Again, we would cover all that to make sure that you're aware. And secondly, insurance,
Mhm.
setting up a clinic, insurance, setting up a clinic, and developing a business case.
So in summary, we're going to talk about the anatomy to stay safe. We'll talk about product selection.
Yep.
We'll talk about patient assessment. We'll talk about issues around advertising, consent, ethics, and we'll talk about business and marketing. And also, most important out of everything, complications and how to deal with them.
Yeah, I mean, that's important. You know, you need to, because, and I'm not sure if Lisa's on the actual webinar, but we were discussing last week just about complications. It's really important for you to know what to do, how to manage, and also when to refer.
Indeed. And I think the other thing that almost goes without saying for a course to be effective, which is why we haven't said, but we should say, is that there will be the opportunity to inject on live models.
Yeah.
As in actual people.
I mean, when I did my foundation day, it was mannequins. And as you
Yeah.
know, I'm not sure how beneficial that was.
I don't think that, to be honest, I don't believe that the mannequins is that beneficial at all, because the feel of I don't know what they use, because I know there are some things that are like a soft, wobbly sort of silicone head, and it's not the same feeling at all. It's just not, and there's no bone underneath. There are some really good simulators out there, but an even better simulator with the appropriate supervision and the education beforehand is a real person. Just go and do that. But obviously, if some people, you know, need a bit more practice of just getting comfortable how to hold a needle, you know, in a ergonomic, comfortable way, that's fine. But we'll go through it for as many times as it takes for you to be comfortable with that, so that by the time you're injecting live people, you're ready. But you're doing it under supervision, and we'll be watching you. So, just for example, if there were 4 people in the room and 4 models, there wouldn't be one trainer just in the middle trying to keep an eye on everybody, like a school teacher trying to keep an eye on their classroom. You know, I'm gonna watch somebody injecting a person, and everyone's gonna watch that as well. But we're gonna just do it one at a time, just so you've got that individual attention that you need. So when some people talk about a ratio of candidates to faculty of 4 to 1, 6 to 1, 2 to 1, you know, when we're delivering the more kind of didactic lecture type or group discussion, that's different, because that'll be 1 to, you know, the whole course. But when you're injecting, that's going to be 1 to 1.
Absolutely, yeah, absolutely. And I think that that's important, because all of you will have different needs. All of you will have different questions. And again, you know, no question is silly. So, you know, definitely by all means, you know, ask. But the reality is that with the right training and someone who's been through it, it just makes your life a lot more easier. The dates that we've set it for, so the first cohort that we're running is on the 11th of April. So I'll put that on the chat now. So it's on the 11th of April. And for the first, so the actual...
Should we give you the dates as well?
Yeah, let me write down. So we've got the 11th of April, we've got the 23rd of May, and we have the 20th of June. These are the dates that we are running the cohorts, okay? It is starting at 1497, which is, you know, 1,497 pounds, but only exclusively for today and tomorrow. Any one of those dates, we are doing it for 997.
Yeah, so we'll do this initial discount for the people who take action quickly. And
yeah,
can I just ask you, what do you think, what was the most important thing? Like, if you were to go back to the beginning, what is the most important thing that you would want to get?
Mentoring.
Mentoring.
In any part of medicine, if you don't have someone who you could speak with, it is difficult. And that's why I made the case for on the LinkedIn of having that some sort of support for pharmacists. You need a support network. It's impossible for someone on day 1 to know everything. Having an access to a mentor, and that's something that we are offering on all our group, is a WhatsApp group. There's a WhatsApp group that we're offering for those students who sign up initially, where you're going to have that mentoring. You know, any questions that you have regarding your, you know, business, anything to do with marketing, anything to do with, developing your practice, you can ask on that group, and we'll go through it with you. That's extremely important.
So we'll have a WhatsApp group,
yeah,
for kind of mentoring processes where it won't just be myself and you. I mean, people can support each other on that journey as well, because you're all going to go at different speeds, go at different stages. But again, with that, because there is obviously, obviously the limit to how big a WhatsApp group can be. So I guess we'll just do that for people who are signing up today.
Yeah, definitely.
Yeah.
Oh, we've got someone who's raised a hand. Ansha, what have you raised a hand? Right. Anand, you can ask a question.
Can we also say?
Right, Anand,
see what the question. Yeah.
Let me have a look. Hi, because I've got Anand who's raised a hand.
Okay.
Yeah, Anand, you can either ask the question kind of live, or if you want to post it to me, I can answer it for aesthetics. I'm guessing he's going to be asking that
while
question.
he's assigning that, I mean, how are people going to sign up?
Right, let me give you the link. So you can just send your info at medlearn.co.uk. Jignesh, nice to see you, that you're here. Wonderful.
Okay,
I hope
so
you're keeping well.
just contact us at info@medlearn.co.uk.
Yeah.
And we'll deal with the paperwork from there.
So this will, just send us a message, raising your interest. And
so for the next day or so, the people between sort of now and sort of 7:30 tomorrow.
Oh, Anand, thank you for asking that question. That's why we've got a Q&A. Absolutely. So let me get Camille as a non-pharmacist to answer that question.
Okay, so
what do you reckon?
The question is, how will it work for someone who is working for an employer, stroke locum pharmacist, i.e. not owning a pharmacy? Well, there are several options for this. If you are an employee and you have these skills, I think you could make a good business case, based on Fahim's numbers, for example, and obviously you'd need to maybe tailor that depending on where your pharmacy was, what the footfall was, and so on, and what your marketing strategy was. You could make a business case for bringing in a new service to that pharmacy. Now, if you were working for a sort of a small chain or an independent pharmacy, I think that would be an easier sell. I believe Superdrug are offering aesthetic procedures now. I don't think Boots are, although we've seen Boots are certainly expanding their services, and so I'm sure it's only a matter of time before Boots will start offering aesthetics as well.
Indirect, I think Camille's pretty much hit the nail on the head in that one. You've got two options. One would be you go and open your own pharmacy, but you don't need to. Option number two would be that you speak to your employer and say, look, if one of my employees had come to me and gave me a business case, I would bite their hand off and go for it. There is no way that I would say, wow, I'd be like, great. Are you telling me that we can increase? Fantastic. There is no way I would turn that down.
I mean, if you suddenly said, look, I've had this idea, I think we get £15,000 a month for 2 days 93. You interested? You're not going to say, no, I'm good. I'm good.
That's one. Secondly, you don't need to do that, Anand. You could actually set up your own clinic. You can set up your own clinic, and again, we would go through that with you on the day itself. How do you, as a non-pharmacist owner, and by the way, even next week's webinar, it's all about not owning a pharmacy. I want to get pharmacists out of this I don't know, conundrum, whatever it is, of, oh, I don't own a pharmacy, how can I do it? You are exactly who's the best person to do it, because the trouble that I have is when I own a pharmacy, everything seems to be limited in my little box. By not owning a pharmacy is much easier. You could set up your own clinic, you could partnership with a beautician, and they would absolutely rent you a space. You could rent a space and easily take it from there. So you have many opportunities. You don't have to own a pharmacy. You could set up a clinic yourself. And again, it doesn't have to be CQC registered yet, and we can discuss that.
Yeah, and also setting up a clinic doesn't mean actually, spending 6 months getting planning permission from the council, building a clinic, etc., and then investing heavily. That can simply be, renting a room in a place and marketing yourself. That can be, within a Medispa, within a beautician place where, there are also jobs available for aesthetic practitioners. There are many options.
I have a nurse who's actually at the moment doing it from her practice that she set up. wonderfully done,
Mhm.
and it's set up herself internally within her own property. It's working fine, because it's not something that requires you to be at the way it stands at the moment. It does not have to be CQC registered if you're a pharmacist. If you're a doctor, that's separate. But as a pharmacist, as it stands, but that might change. It doesn't have to be CQC registered. So technically, you could set up a clinic. You could easily set up a clinic, and that's a room, by the way. We're not talking about you spending hundreds of thousands of pounds setting up a clinic. It's you renting out a room. I would personally suggest that you go to pharmacies and approach them and say, look, I want to set up a clinic here, or rent out a space, rent out a room. You can go to a spa, you can go to a beautician, you could rent out a space. You could, in theory, if you had the space, you could do it in, you could probably do it in your, not that I'm advocating this, but you could probably do it in your own space.
You can get creative, yeah.
Yeah.
Space. Okay, so we take some more questions there. Is 1 day's training enough to be competent to begin administering aesthetic treatments? Competence is a very difficult question. I think it depends, because with a lot of things, I mean, some people will do a training and they will decide it's not for them, and that's okay, but you don't know until you've actually, looked into it properly. It's like anything. It's like when you pass your driving test, yes, you can drive, but after you've been driving 5 or 10 years, you're going to drive a lot better than you did the day after your test. So I think it's about getting practice and about getting mentored. So I think with support, but I mean, on the day, there'll be enough to be able to administer Botox and fillers safely, but you won't be very experienced because you'll have just done 1 day.
Yeah. But I think, you having access to mentoring goes a long way. I think if you didn't have access to mentoring and you had done a 1 day's training course anywhere, I don't care where you go, I'm willing to, put money on that. But if you are you've only been trained once, and you've only ever lifted a injection once, and you have access to no mentoring, I really can't see that working. I think you're going to struggle with that.
Yeah.
The mentoring is important. Absolutely. Q&A. Is it necessary to be, good question, right. Is it good question. Is it necessary to be an independent prescriber in order to do aesthetics? No, it's not necessary, but it does help. And the reason it helps, because if you're not a prescriber, you need to get hold of that Botox and filler from somewhere. And as it stands, you're not able to do Botox and filler consultations unless it's face-to-face. So as much as I'd want to help everyone here, but if I'm in Oxford and you're in London, I can't do a Skype consultation for your telemedicine with that. So you being able to administer Botox and fillers, yes. You being able to prescribe it, no. That's why, non-medical prescribing, it does help. It does help. But then again, if you're going to do non-medical prescribing, don't limit yourself to just aesthetics.
No, there's a whole world of stuff out there.
There is so much you can do. So don't limit yourself just to aesthetics, but do your aesthetic. Look, like I said, look in my practice, we do aesthetics, Botox, fillers, prescribing A to Z. We do the mastery program. So you want to combine everything. And it's, ultimately that's what you want to do. But yes, non-medical prescribing, being an independent prescriber will help. But it doesn't stop you from developing your competencies. It doesn't stop, I was seeing an ad yesterday in one of the clinics in London, and there was something like, I think close to £100 an hour, looking for a locum who can inject aesthetics. There's a market
they'll
for
do
it.
all the marketing for you.
Yeah, you literally just turn up to work.
Yeah.
Again, as a pharmacist, you tell me locum rates. I know Darren the other day was telling me around £35-40 an hour. But £100 an hour for Botox and fillers, opens your horizons. Why not? But obviously, if you were a prescriber, you have the advantage that you can start prescribing for other clinics.
Yeah.
Again, we'll be discussing that next week about why it's important to get your non-medical prescribing and how to become good at that. But there are opportunities. Does that answer your question? Does anybody else have any questions? Perfect.
Okay, well, shall we wrap it up then? And hopefully we'll see some of you in April.
Yeah.
So info@medlearn.co.uk, 997, and access to the WhatsApp group between now and 7:30 tomorrow.
Yep. You have 24 hours, inshallah. Get in touch. Any advice you need, any questions you have, get in touch and we take it from there. Again, everyone, thank you for your time. Next week, Again, apologies for the webinar link. I'm not sure why this happened, but next week we are focusing on that question, which I'm fully going to address, is how will it work for someone who is not a pharmacist owner of a business? That is what we're addressing next week. And we're going to be talking about the mastery program. We're going to be talking about developing your competencies, and also, inshallah, starting hopefully, in a couple of weeks' time, we are doing a webinar series on physiology. So I'd like to invite you all to that, and I look forward to that. And thank you for your time, Camille.
Yeah,
Thank you very much. Thank you.